from the strict medical perspective, if you just want to look at it from the narrow medical perspective, what are addictions? And the medical perspective is not wrong so much as it is hopelessly narrow, but it's still useful. So what do we see when we look at addictions from a medical point of view? Well, what we see is a lot of people self-medicating medical conditions is what we're seeing. What do people self-medicate? There was a study with the American Army within the last year in Iraq. Soldiers given a little bit of morphine after a potentially traumatic incident have less preponderance to developing post-traumatic stress disorder. Opiates treat PTSD. Many of the addicts in the downtown Eastside, the ones that the police spend their time chasing in the streets, are actually people who suffer from severe post-traumatic stress disorder. And that's why they're using the opiates to self-medicate. Why they have PTSD, I'll tell you very shortly. What else do people self-medicate? People self-medicate depression. If you've ever taken Prozac, as I have, for depression, Prozac is intended to increase the levels of serotonin, a brain chemical implicated in mood control in your cerebrum. Well, cocaine also elevates serotonin levels. People use cocaine to self-medicate depression. Now, if you've been diagnosed with attention deficit hyperactivity disorder, as I have, you might call me a compendium of medical problems. I've been prescribed dexedrine, which is a stimulant. I don't take medications anymore. I don't need to. There are other ways of dealing with life, but I did, and I'm grateful, and they help me. What dexedrine does, or Ritalin, is it elevates the level of dopamine, which is another important brain chemical. I'll tell you about it in a while. It actually calms down the hyperactive brain. What does cocaine do? What does nicotine do? Or crystal meth? Or caffeine? It elevates dopamine levels. People self-medicate ADHD. A good 30% of people in jail in kids' country suffer from ADHD. That's why they're there. They self-medicated through some substance that happened to be illegal. And nobody knew they had ADHD, and they didn't know they had it. This is not only my personal opinion, I'm talking about population studies here. What else do people self-medicate? Anxiety. What does the alcoholic do? He's anxious, he has a drink. Social phobia. He feels shy, his tongue is tight. He has a drink to loosen his tongue. He's now more sociable, more voluble. People self-medicate bipolar disorder through alcohol and drugs. Through marijuana, people self-medicate anxiety, people self-medicate ADHD, because pot actually calms down the hyperactive brain. So on one level, you can see addictions as self-medications. Very often, self-medications without actually awareness of the condition that's being self-medicated. That's on the medical level. Now let's go a bit beyond, though, and let's look at the brain, the addicted brain. Well, what are people addicted to? First of all, the opiates. Opiates are derivatives of opium, which grows, of course, in Asia and countries like Afghanistan. And the opiates have been used in Chinese medicine and in other medical traditions for thousands of years. What for? Well, for pain relief. Opiates are the most powerful pain relievers that we have. For 7 years, I was the medical coordinator of palliative care unit at Vancouver Hospital, looking after terminally ill people. And thank God for the opiates. Without them, many people would die in great states of suffering. But the opiates don't only soothe physical pain, they also soothe emotional pain. In fact, the same structure in the brain that interprets the emotional significance of physical pain also responds to the emotional significance of psychological pain. And when you do a brain, we're experiencing a moment of emotional rejection, the same part of the brain will light up as if you stuck them with a knife. So opiates are a response to pain. So the first question in addiction is not why the addiction, but why the pain? Because all the addiction substances actually are pain relievers. Cocaine is a local anesthetic, if you will. Marijuana, of course, in palliative care, when people had nerve pain and the opiates and other modalities didn't work, we would prescribe people cannabis. Alcohol, what do you say about somebody who's drunk too much? They say he's feeling no pain. So the addictions are always about relieving pain, and the question is, why the pain? You want to know why the pain? I don't have a single female patient in the downtown Eastside who wasn't sexually abused as a child. That's why the pain. The men were also abused, if not sexually, although a large percentage was, a large minority was, then physically and emotionally, and abandoned and neglected. So there's a surfeit of emotional pain in the hardcore addict,